All right, good evening, everyone. Peace and blessings, and welcome back to the STEM Files, where we serve as the voice of STEM talent and Black culture, where we serve our we strive to give you the best and brightest in science, technology, engineering, and mathematics in the Black and Brown community. Tonight, we're building with three-time guest and return guest, Sister Dr. Naa'irah Muhammad. This is the season premiere of the STEM Files, and this is about to be lit, family. So we're going to be building with Sister Dr. Naa'irah Muhammad. She's going to be having an inspiring conversation with us, a trailblazing, up-and-coming cardiologist, reshaping the future of heart health. Stay tuned, family, for more after this.
You believe in these false prophets, I say I bet he lying. No football, New York City Giants. Girl dad, rest in peace to Kobe Bryant. When we teaching our babies, we teach them heavy science. Heavy science. Heavy science. When we teaching our women, we teach them heavy science. Heavy science. Heavy science. When we teach men, we teach them.
I am Dr. Naa'irah Muhammad. I am an internal medicine resident physician at Henry Ford Hospital in Detroit, Michigan. I have a passion for cardiology and heart health, along with preventive medicine. I am happy to announce that I will be your next guest on the STEM Files on September 19th for the season premiere. Look forward to talking to you all soon.
All right, family. Once again, as our brother Papoose said in our opening intro, this is the STEM Files, where we teach men, women, and children heavy science. I am Tariq Muhammad, aka Tariq Cardiac. I'm a biomedical research scientist with a concentration and background in cardiovascular pathobiology, which is the study of how diseases form in the heart and blood vessels, as well as how these various diseases can be treated in various types of clinical settings. Family, I'm usually joined by two amazing people. They couldn't make it today, but they're definitely here with us in spirit. Jabril, aka Jabril Muhammad, aka Jabril Engineer. He is a civilian mechanical engineer with the United States Navy. He has a background in material science and engineering, the study of how various properties of material classes and how these materials can be used in various applications, making things faster, stronger, more effective, and more efficient. And then, of course, lastly, our third newest addition to the STEM Files team is Sister Dr. Joy, aka the Chi Mechanic. She has been studying and practicing traditional Chinese medicine for ongoing 13 years now. And TCM, they understand that the body innately knows and desires to heal itself. The medicine she offers is here to assist you in that journey like a mechanic for your vital energy. Family, once again, thank you all for tuning in to the STEM Files. We serve as your voice, your authority in all things Black and STEM. I'm excited for tonight's episode, not just because we share a similar background as it relates to cardiovascular medicine, but because Sister Dr. Naa'irah has actually been a STEM Files alumni since the moment she graduated the Latin American School of Medicine in Cuba. So without any further ado, please welcome back to the platform, Sister Dr. Naa'irah Muhammad. Assalamu alaikum.
Wa alaikum salam. Thank you so much for welcoming me back to the show. I'm very excited to start our discussion for tonight. And I'm happy to be back. Like, I'm so excited to see what you all have done with the show. It's evolved so much since the first time I was on here. So I'm very proud of you both and the new addition to the show, Dr. Joy. So thank you so much for having me.
All praise due to Allah. You know what? And that's key right there, is being able to see growth, right? To be being able to look at something and see how it's evolved over time and how much work is put into something to make it what it is today, right? And that's what you've done with your career. You've been able to come from undergrad, go to a school in another country, come back successful, match into a phenomenal program in Detroit. So tell us how that's been so far, from going from, graduating from a very, very meaningful program in Latin American School of Medicine in Cuba to where you are now. Let's unpack that journey a little bit.
Yeah, absolutely. So what he's referring to, I'm originally from Philly. I went to undergrad at the Lemoyne College in Memphis, Tennessee. And then I went on to Cuba at the Latin American School of Medicine, or known as ELAM, to study medicine and get my medical degree. And I am now at Henry Ford Hospital in my last year of internal medicine training at Henry Ford, and now interviewing for fellowship or training in cardiology. So, initially it was an adjustment, training in a different country, a developing country, and then transitioning back here where we have a lot more resources. We're a lot more technology driven. and coming from Cuba, who was a lot more focused on, I would say, hands-on training, physical exam. And not to say we're not focused on that here, but, we have a lot more technology readily available at our hands, where Cuba didn't really have that. So it was an adjustment. I mean, even in Cuba, we were still using paper charts. So we were still writing out history, physical examination.
Yeah.
And then I get to, the hospital here, and we're using electronic medical records for everything from patient communication, from ordering labs to writing up notes. So it was a huge adjustment. Not only that, in Cuba, all of my medical training was in Spanish. So I come back here, and although I was in Cuba, I was studying in English and in Spanish, but I get back here and everything's back in English again. So, that part of it was nice. And I will say that, Cuba really prepared me either way. It prepared me really well for training here back in the States. I'll state it again, the mission that Fidel Castro had for the Latin American School of Medicine was to train international students to go back to their medically underserved communities and practice medicine. He said, we didn't want you to stay in Cuba. We want you to go back to your communities where you come from, where the need is, and practice there. And he made the statement that he knew that there were third world communities in first world countries. And that sat with me. And as I'm practicing, as I'm training, I'm here in inner city Detroit. So I am here with the quote unquote, with the medically underserved community, with our people. And unfortunately, we don't have a lot of resources. We don't have a lot of access to care. And, one of the things that Cuba also emphasized was also preventive medicine, public health. That was something very big that Cuba instilled in us throughout our training. And in addition to me, I grew up in the Nation of Islam as a Muslim. We're taught, how to eat to live. But also I grew up in a household where my mother, very big on nutrition, even still to this day. She is very big on what we eat, how we eat it, how she cooks it. And my father, who was a freaking weightlifting champion back in the day, and still big in the gym. Like, I grew up in a preventive household. So my background, my upbringing, and being in Cuba, all of that prepared me very well to practice medicine and here in the States in our medically underserved communities, and to have a love and passion for preventive medicine. So I am pursuing a career in cardiology, but also prevention is always going to be the base and the mainstay of everything that we do. Ultimately, I'm interested in interventional cardiology, which is the cardiologists who do the minimally invasive procedures, those who are able to place stents. But preventive care is a very large part of that, because if I'm able to see you and prevent a heart attack from happening before I have to, eventually place a stent, then that's where the work needs to be done. And not only, we have, there's actually a specialty now called preventive cardiology, but guess what? Prevention can happen at the primary care level. Prevention can happen with your internist. Prevention can happen with your family doctor. So I know I said a mouthful, but I'm saying all that to say that Cuba prepared me very well. And in addition to that, being in the inner city, where we're right near Mexico town, and I'm able to speak to the Latino patients that are coming in. And it's even not only is it like a sigh of relief for the Black patients who see me, because unfortunately, it's not many of us, although we're the majority of the patient population. But even when I see a Latino patient and I'm able to communicate with them, they're kind of like, wow, okay, so this is another community along in the medically underserved community, and included in that I'm able to connect with and communicate with. So the journey has overall prepared me very well. It was not an easy journey, but I think that it set me up to be right where I needed to be.
Absolutely. And I'm glad you mentioned the aspect of having third world communities in a first world country, right? But before I tap into that, let's go a little bit further back in terms of your training in Cuba, right? So you mentioned how the resources are limited, right? I mean, we're talking about, not having the same amount of, funding or resources that the schools in the United States have. So can you expound upon how that type of training has humbled you before you even got back to the States to train in your residency program, right? Can you talk about, what are some of the key things that you learned on how to deal with certain issues or struggles while, you're starting your residency program? What are some of those humbling things that you were able to kind of apply to where you are now?
That's a great question. So I think Cuba has humbled me in so many ways. I think that Cuba in itself and being, working immediately with essentially Cuba still is a medically underserved community, despite they have good health outcomes, but they are a medically underserved community. That's a place where unfortunately a lot of it you are operating out of survival mode to a certain extent. You don't know when the next shipment of medications are going to come. You don't know when the next and this is just basic stuff, toilet paper, detergent. You don't know when it's going to come again. And so I recall being one of the things we had to do in Cuba was we had to do what it's called a community health analysis. And this was a quality improvement research project that involved us actually going door to door and talking to each of the families to ask them what were some of the barriers or what were some of the barriers in their health? What was going on in the community? What was going on in their households that was making it difficult or that was limiting some areas of their overall health or causing disease in the community? And a lot of times, even here at home, I think we, as physicians, have a perception of what we think is going on in the communities. But then when you talk to people one-on-one and get a better understanding of what's going on in their households, what's going on in their communities, you get a better idea of the need and the necessity. And so one of the things that Cuba was really big on, Cuba is big on holistic medicine, integrative medicine. Cuba, they incorporated, quote unquote Western medicine and medications, but Cuba also incorporated the herbal medicine. They incorporated acupuncture. They incorporated telling patients to do Tai Chi and, and all sorts of things. And I think that has helped me, number one, understand that, there's other parts of our lives that could be affecting our health. There are other ways that we can help a patient achieve that overall health and well-being. And then not to mention just learning how to depend on, sometimes we want to depend on some blood work, or sometimes we want to depend on some imaging, an x-ray, a CAT scan, which don't get me wrong, these are great technologies that we were able to develop. But what Cuba taught us at the basis is, what does your physical exam look like? Your physical exam starts when the patient walks through the door. What do they look like? How are they walking? How are they sitting down? How are they getting up from the chair? What are some of the symptoms and signs that you're picking up just with your hands? That's something that Cuba told us to rely on, because just in case you can't get that chest x-ray, when you listen with your stethoscope, do you hear crackles in their lungs? Not to say we don't do that here, but Cuba relies heavily on that physical examination and being able to use some of the things that they have just at their hands. I'm trying to think of just different examples to give you a better idea, but Cuba they're very, very resourceful. Yeah, they're very, very resourceful. I got so big on recycling in Cuba because everything had a need. Like you're not throwing away anything. That water bottle, don't throw it away. You're going to use it for something else. This bucket that you don't throw it away. You're going to use it for something. This plastic bag, I was recycling Ziploc bags. Okay, hold on, we're going to wash it out. We're going to find another purpose for it. So I think in Cuba, it taught me resourcefulness. It taught me patience, and it taught me empathy, because I'm leaving, from my medical school, and I'm traveling back home where I have air conditioner. The patients in the hospital don't have air conditioner. It's 90 degrees outside. We don't have air in the hospital. So all of us, the doctors, the patients, we're in 90, 95 degree weather in the hospital. Patients are already sick, but we're also sweating. It's humid, so it's, you learn compassion, you learn empathy, and you just learn to be more grateful. And like I said, you learn resourcefulness. So in addition to Cuba teaching me just holistic medicine and understanding that everything does not have to be black and white, and it is okay to use these other areas of knowledge to help you heal the patient. I think those are some of the things that Cuba has helped me, that I've taken on from my medical training in Cuba.
So you're talking about the recycling, right? So I'm interested in knowing what were some of the things that you had to make while you were, like, if you took a plastic bottle or plastic bag, what were some of the things you had to turn that into to do something else?
So in Cuba, so for example, one of the things they would use the water bottles for is like to make ice. Like we have ice cubes, we have ice trays. So they'll use their water bottle, they'll put it in the freezer, cut up and they'll break it, and that's how they make their ice. Or even in Cuba, they didn't have, like, for example, babies. They were still using the old cloth diapers. They weren't using Huggies or whatever the other brand names are of the diapers. They were using actual steel cloths, washing them out, reusing them again for their babies, for their infants. For my Ziploc bags, I just had to reuse them when I was storing food. Like I just had to, if it was storing this one day, maybe storing, or if I had to just put away some cotton balls or something, like, it just came in handy for random things. And I'm trying to think back to more examples for you, and I'm sure my mom probably remembers all the stories. Sometimes I forget. My mom's like, "Don't you remember when?" And I'm like, "Oh, I forgot about that." So, but
All right, so we have a question from the audience, and I kind of I'm gonna elevate this question because it's actually along the lines of what I was about to ask you. So this is from Starving Myself to Life. We need to break the cycle of going to see medical experts only when we get sick. We need to be conditioned to seek out medical attention to maintain good health. Why wait until you get sick? So let's talk about the importance of being preventative, being proactive, being ahead of whatever may come down the line. Unfortunately, Black people, we deal with quote unquote genetic disorders, even though we know, as we're taught in the Nation of Islam, that the way we live our lives can negate anything that we may be dealing with genetically. So can we talk about this issue? Because we, as Black people, people in general, sometimes we just like to wait until you can't move no more to go see the doctor. So let's talk about the importance of this.
Wow, I love that. I love that. And that is literally my motto every single time. Unfortunately, so it's very multifaceted, right? Because I think on one end, you have, in our communities and what I have experienced in a hospital, there is a certain level, there's a level of mistrust in the medical system, the healthcare system. Rightfully so. We understand that there is a history there, rightfully so. But unfortunately, with that medical mistrust, we have also avoided going to see any type of healthcare professional. And I'm seeing you when you're admitted to the hospital, unfortunately, after a heart attack, after a stroke, after, when you're here with heart failure that is just severely uncontrolled. And so I love this, because that's the whole idea about preventive medicine, is that if we can get started before we have an event, then that is the prime time to get tapped in with a primary care doctor. Find somebody that you connect with. Find somebody that you are able to ask questions to, that you are able to have a conversation and really express some of your concerns, some of your hesitations. I think that, and it's okay. I think sometimes not every event is avoidable, but I think the earlier we can get in tapped in, like I said, with the primary care doctor. And not only that, think about it. Unfortunately, we also are the main ones going to the emergency room. But why is that? Because we don't have continuity of care. We don't have primary care doctors that we are seeing on the regular basis to help avoid that next ER visit. So unfortunately, we're coming into the ER when things are already so severe. We're coming in when things have already kind of reached its max, and we're kind of like, we're at the end of the road. But if we're able to see a primary care doctor, have our annual checkups, be able to check our blood pressure, see what our baseline kidney function is, see what our blood sugars are. If we're able to do that at least once a year, depending on what your medical history may be, that could hopefully prevent the next event from happening. And it's interesting because in research, and Tariq, you probably know this, there's this measure called number needed to treat. And this pretty much the measurement of how many people do we have to treat with this certain medication or give this certain intervention to before one person benefits from it. So how many people do we have to talk about prevention? How many people do we have to educate on healthy lifestyle changes for us to have that, to prevent the next cardiovascular event? So I think that is very, very important. That is the basis of what I have been doing since medical school, throughout residency, and currently what I'm doing and what I plan to continue doing. Because even as a cardiologist, once again, we're still primary care doctors at our base. We still have to help emphasize healthy lifestyle to help prevent adverse outcomes.
Absolutely, absolutely. And we're talking about the continuity of care, right?
Mm-hmm.
Some of the things that the doctors who are passionate about helping people in these inner city communities with these patient populations that are dealing with the most of these continuity of care issues, how can they create a safe space for the
Mm-hmm.
or for that person who's dealing with these issues, so that they can actually want to have that continuity of care? Because oftentimes they, like we talked about before, they're looking at history, they're looking at how the doctors treat them now, they're looking at the waiting room in the emergency room, they're looking at all these different things. How
Mm-hmm.
can doctors come together and create these safe spaces for the patients to want to have that continuity of care?
That's an amazing question. One of the things, so number one, sometimes it gets a little difficult when you get into talk about our communities, unfortunately, the Black communities, because the Black doctors are the minorities as well. So sometimes people do want a doctor that looks like them, and that's okay. That is okay if you want a doctor that looks like you. It's nothing wrong with seeking that out, because it has been shown that we have better health outcomes when we have someone that looks like us. I can't tell you how many times I have, and it's funny because you see my name, Naa'irah Muhammad, and they're not expecting
Right,
me to walk
right,
through the door. And
right.
so when I walk through the door and they go, oh, like it's like, oh, like a sigh of relief almost. And it's kind of unfortunate because I hate that that's sometimes the feeling that we get when a physician comes into the room and it's time for us to, and it's really an intimate space. That's a intimate time. You're meeting with your doctor and they're looking at your labs and looking at your, and looking at your blood work, look and examining you, and you're talking about your health. And that's a very intimate time. So
Absolutely.
one of the things that I would say as physicians, for sure, we also, I know at Henry Ford we get this training, but asking certain questions, because sometimes, when you're talking to patients, they'll give you very, closed-ended type of questions. You're like, hey, how's your diet? Good. Okay, tell me more about that. Or let's say somebody comes in and maybe last time you saw them, y'all had a conversation about eating healthier, getting more fresh food, more vegetables, more fruits, less processed foods. And let's say they come back, blood sugar still aren't controlled. How about we take out the judgment from it too, and let's ask, well, what may have been some barriers that prevented you from
Mm,
getting the healthy food?
right,
Because sometimes too, what we also encounter is that unfortunately there are other barriers. And sometimes, number one, they don't fully understand. So there's a lack of health literacy. So sometimes the doctor is talking to you and you don't fully understand what they're saying, but because they're the doctor and the person in the white coat, you feel as though they have a certain level of authority. So you're just kind of like, okay, all right. And they end up leaving a visit and they don't know what you said was wrong with them. They don't know why you put them on a certain medication. You said, okay, eat healthier, exercise, but they didn't fully understand what that meant.
right.
So I think on one end, I want to encourage everybody, patients for sure, to feel empowered to also take control over your health. Feel empowered to ask questions. It's okay to not just say, okay, sure, I'll take it. Oh, you want me to exercise more? What does that look like? And us as physicians, it is our job to explain that to you in a way that you can understand. And that involves us, not, like I said, taking away the judgment, asking questions. Sometimes when people are they're giving closed answers. You can notice sometimes their body language. We have to pick up on those signs and be like, okay, what's hesitating you from getting your colon cancer screening? Let's talk about it. Let's sit and actually talk about it. Because sometimes we, like I said, we either the patient, we say okay, we keep it moving, and you leave, you like, I don't really know what they said to me. Or sometimes too, as physicians, we do have our own biases that we have to be mindful of, and our own judgment that we have to put to the side to actually understand where the patient is coming from. And sometimes you realize that sometimes there is a conversation that can be had to bring better understanding and better knowledge. So then that way they can take better charge of their health. They can pick up more nutritious foods when they go to the grocery store. They can participate in more exercise because they know now, okay, this is what it actually looks like and what I should be doing. So I think overall, that's what I would say. We have to take away the judgment, and then also patients should feel empowered to be involved in their care. One thing that we're taught as doctors is shared decision making. That is not me making a decision about your health. That is us making a decision about your health. Does this make sense to you? Do you understand this? Are you okay with this? That has to be a conversation. And patients have to feel empowered to engage in that conversation. Ask them questions. Don't feel afraid, because it's your health at the end of the day. You are the one who wants the positive outcome. We want it too, but you have to be more invested as well. So I'll stop preaching.
No, you're good. You're good. This is what the STEM Files is all about. Just, whenever you want to stop, you stop. But to some of those doctors out there, stop scheduling so many patients back to back so y'all patients can have enough time with y'all during the visits. That's all I'm saying. Don't be having 30 people one day and all you got is 10, 15 minutes to talk to them. Come on now.
I agree.
Their health, All right, family. So let's get to the commercial break. At the 30-minute mark or the halfway point of the program, we always like to talk about the Final Call newspaper. So family, please stay tuned for more after this.
Now you can get the same uncompromising truth you've come to expect from the Final Call newspaper on all your connected devices. Subscribe to the Final Call digital edition today. Go to subscribe.finalcalldigital.com.
This is Sister Ilyasa. We're at the National Training Convention, and you're watching the STEM Files.
All right, family. Now, this part is usually designated for Jabril. So whenever he's not on, I always try to, make sure I do it the way he does it. So family, this week's edition of the Final Call newspaper is all about the reality of the wheel. Family, around the Nation of Islam, we are commemorating the anniversary when the Honorable Minister Louis Farrakhan shared with the world that he had a vision in his dream about being elevated onto the mother plane. Family, if you would like to hear more about this story and understand why this particular experience that the Honorable Minister Louis Farrakhan had is so important, please visit finalcalldigital.com. If you are in the Atlanta, Georgia area, tap in with Jabril. If you are in the Richmond, Virginia area, tap in with me. If you're in Greensboro, North Carolina, tap in with Sister Dr. Joy. And of course, if you are in Detroit and you bump into Sister Dr. Naa'irah, I'm sure she has at least a couple final calls in the back seat that she can give you. But family, this is the flagship product of the Nation of Islam, the Final Call newspaper. News you can use. Latest issue of the Final Call, volume 43, number 51. And if you would like to consume this amazing product and the news that can help transform your life, please visit finalcalldigital.com. Once again, that's finalcalldigital.com. All right, Jabril, if you're watching, please let me know if I did that justice, because I'm telling you, bro does that part phenomenally. Like, he can be a spokesperson for Final Call, absolutely. But so let's get back to this conversation. So I have another interesting question in the comments. So we're talking about preventative medicine, right? And we're talking about, what are some of the things that we can do to avoid cardiovascular events. But let's expound upon what happens after, right? Because sometimes, we as a people, we just got finished talking about we're not as proactive as we should. Things happen, and now we have to deal with the ramifications, right? So this is from Jill Muhammad. What lifestyle changes do you recommend for post-heart attack patients?
Absolutely. So that's a great question, because like you said, that is a large part of our community that has experienced a cardiac event. And I think the actual lifestyle changes are indeed the same. So we still can implement those healthy lifestyle changes to avoid another attack. So when we say healthy lifestyle changes, what does that include? We all know about how to eat to live, but healthy dieting. So number one, increasing the guidelines, actually the American Heart Association, American College of Cardiology, they also recommend plant-based Mediterranean diets. So diets rich in vegetables and fruits and legumes, or our beans, like our navy bean, black beans, whole grains, so our oatmeals, which are also known to be very healthy, our brown rice. All of those are going to be things that you can still include in your diet. Our healthy fats, like our avocados, our low fat yogurts. So these are all things that we can be including and implementing still, because what happens is when you have a heart attack, there's a part of your heart that has blockages in it, which includes cholesterol, calcium, cell debris, that have cells that have died, so they all build up there, right? So there are other arteries around our heart that are still open, that still have good blood flow. So we have to still preserve those arteries. And a lot of times when we have a blockage in one of our arteries, the body is so smart that sometimes we have what we call collateral. So we'll start getting some new blood vessels around to help supply that area that was dead. So we have to try and still maintain that healthy lifestyle to preserve and protect those other arteries. And that also includes, I meant to mention, decreasing our fried foods, very fatty foods. That's going to be something very important. And our exercise. Exercise is very important to cardiovascular health. So even if you're only able to walk, even if you can only do chair exercises, you start at the level that you are able to do it. Of course, there's a recommended level of exercise each week, which will be about 150 minutes of like moderate activity. But for those who can't move around that much, we can start little by little. Like I said, if it's walking, if it's chair yoga, if it's, some light house work around the house, all of these things are helpful. Another thing we can do, something very big that I don't think a lot of us think about, is our stress levels. Our stress levels, the stress that the brain and the heart are interconnected. So when we're stressed, our body secretes a hormone that tells our heart, oh my God, beat faster, beat stronger. Our blood vessels constrict. So think about, especially in our community, we have a lot of stress. All of us have stress, but finding ways that we can relieve that stress and putting less pressure on our heart, less resistance that our heart has to beat against. All of this is all connected. If that's journaling for you, if that's going to therapy, if that's walking, whatever that may be, whatever that stress, we're doing a puzzle, coloring, whatever, finding ways that we can implement ways to relieve our stress is also very important. Keeping our weight down is very important. So all of these things, although you may have suffered a cardiac event, that does not mean that you are exempt from doing preventive lifestyle changes, because that can help prevent another event in your life.
That's right. That's right. You want to stay out the hospital. You don't want to go back. So if you suffer from a cardiac event, you want to be able to put yourself in a condition where, your body is no longer, because let's face it, when we go through health issues, our bodies can get accustomed to the problem, and we want to be able to put ourselves in a condition where, okay, now you're changing your lifestyle. Now we can, focus on getting better. You're not impeding on the body's natural way of healing itself. Now we can, do our part the way we can do it. So.
And I just want to add, because I know, there's another thing, because I know some people that have suffered, heart attacks, who may deal with heart failure, diabetes, high blood pressure. I just want to add that I know also in our communities, we're very big on not using medications. If you are not going to use the medication, I would say make sure you are safe and being closely followed. I do not recommend, I'm not telling anybody to stop taking any medications, because I do think that they have a role. I think that they have a role. And I think especially in situations where our lifestyle is not optimized. And sometimes, we are in situations, and I'll just give you an example that I had today. I had a patient admitted to the hospital with what we call diabetic ketoacidosis. So mean her blood sugars were extremely high, that her body was now acidotic, and she, had kidney dysfunction, so many things because her A1C was 12. So normal, you want to be less than 6.5. And what happened? Maybe months ago, about a year ago, she said, I'm just not going to take my medication. And I don't know exactly what lifestyle changes she was making. She wasn't really clear about that. But we have to be mindful that we need to just stay closely following with the doctor. Do things safely. Find somebody, a physician that you trust, that you can talk to, that listens to you. But I would encourage people, if you have had a heart attack, if you are taking certain medications, there's no shame to people who have to do certain things for their health. But I want to just say, do things safely and make sure you have a doctor following. So, because I know that that's a big thing in our community, and I see it a lot. I see it patients that are admitted. I see it patients that I see in clinic, and we just stop cold turkey. And next thing I know, I'm seeing you because you have a heart attack now, because also you have high blood pressure that was not controlled. You were not checking your blood pressure at home. We can get home blood pressure cuffs. If you don't know how to get one, ask your physician. DM me. There's actually a girl. I wish I had her website handy. Another Black physician here. She has a website where she sells blood pressure cuffs at a lower rate. I'm going to find it, and if you put my Instagram up later, I'll say it or at the end, so that way I can post it. But anyway, doing things safely under controlled environments, because I do not want people to have adverse events just because sometimes there may be some aversion to, some of the treatment strategies that may be implemented at the time.
I'm glad you brought up that the sister that sells blood pressure cuffs, because I literally just told my team, the Ministry of Health team here in Richmond, that everybody should have, a blood pressure cuff, whether it's manual or electronic. But I wanted even the non-medical professionals to have that on hand, so that, while in a mosque or at a Nation of Islam event, somebody can do something in the event of somebody needing some type of medical assistance. But I'm glad. Thank you. So we definitely gonna put that in. So just text me that, and I'm gonna make sure we put that up.
I got you.
Also, I wanted to kind of highlight a comment from my natural girlfriends. She said sometimes, depending on the area, doctors may not have a choice but to have back-to-back patients, especially in the rural, high-populated areas. That is very true, and I'm glad she put that up there because, often, if there's a particular type of doctor that you need to see, and you live in a very highly populated area, they may not be able to afford to go to another county, another city to see another physician that does what that particular physician specializes in, right? So that's very important. We also have to look at the area. We have to look at how many doctors in that area specialize in that particular thing, and then you make your decision based on that. But yeah, absolutely. And this is from Starving Myself to Life, fasting. It's a must. Eating every 3 days, it's a struggle, but it's necessary. Have you experienced any patient care where somebody was fasting and they were able to lower maybe their blood pressure, their cholesterol levels, maybe even glucose levels? Have you seen anything like that?
Yeah, so I've had a couple of patients that, and not strictly just with fasting. I've had patients who who do the intermittent fasting, but I've had patients who have strictly went in with lifestyle modifications, including the intermittent fasting, and they have been able to reverse their diabetes. They have been able to bring those blood sugars down. They have been able to come down on some of their blood pressure medications. Absolutely. But like I said, once again, what I would say is make sure you're going in, seeing the doctor, and when it's time for you to stop taking that medication, check in with somebody. Make sure everything looks good before you just stop cold turkey, because sometimes it doesn't always go the desired route. But absolutely, I wholeheartedly agree that the fasting is definitely helpful, as well as implementing those healthy lifestyle changes. I have seen some patients reverse some of their chronic conditions. Absolutely.
It's a process. It's all about stealing away and doing it properly under the right supervision. You can overcome anything. Honorable Elijah Muhammad said it. So let's just be mindful of how we're doing it.
Absolutely.
So you went to London just recently. It was about 2-3 weeks ago.
That sounds about right. Yep.
Yeah. Mm-hmm. And you presented some research you were doing. Yes, Doc family, those who are watching, internal medicine physicians also do research. Some of them, they also have some clinical trial experience as well. But I wanted to just kind of go over that experience when you go into London, present your research. I have a few pictes up. So this is you presenting your research. And correct me if I'm wrong. Is this your research, or is it a combination of you and a few other doctors? Or
So no, this is just me. I did it myself with the head of our lipid clinic here at Henry Ford, Dr. Corey Russell. So it was primarily myself. She was helping to help supervise and just provided a little guidance, but this was solely me, pretty much. Yeah.
Got you. And you said lipid clinic. So for those who are watching, for anybody that has been watching the STEM Files or listening to the STEM Files the last 8 years, we're always big on terminology, breaking down words so people can understand what we're talking about, right? So everybody knows what we've all heard heart attacks, we've all heard strokes before, we've all heard diabetes. You said lipids. So can you break down for the layperson, for those who may not understand, what is a lipid and what role does that play in cardiovascular health?
Yes, I should have known better. My mom was always like, "What are you saying? Explain what you're saying." They don't know what you're talking about.
It's all good. That's what we for.
So the lipid clinic, so there is a relatively newer realm of cardiology, which is preventive cardiology. And a part of that preventive cardiology are cardiologists who specialize in lipids and management of your cholesterol levels. So lipids is a medical term for their fats. And so there are different types of fats and cholesterol that travel throughout our body. And these are actually specialists in preventive cardiology and in lipids and their metabolism. And particularly for patients who have very high, uncontrolled cholesterol levels, this is what that clinic is for.
Absolutely. And, when I first started my research in high school, right? And I started my journey in VCU's Pauley Heart Center. And at that time, it was one of the most successful cardiovascular science laboratories in the country. Mm-hmm. And my research focused on being able to control lipids via diet, and then, of course, being able to create interventions after or during an examination, or not necessarily during an examination, but once the examination takes place, the doctor discovers the blockages, being able to create solutions to remove the blockage, right? I'm not going to go too deep into it, but for those who know me, they know exactly what I was doing with that research. But lipids are very important. A lot of times, when someone says cholesterol, they automatically think it's bad, mm-hmm. right? Mm-hmm. So can you educate the people on how glucose is not a bad thing, cholesterol is not a bad thing. These are very important things that the body needs. We make them bad by how we live our lives. So can you go a little bit into the importance of cholesterol, the role it plays, maybe in the functioning of a cell, and then as well as for glucose?
Absolutely. So like Brother Tariq said, these are essential proteins, compounds in our body. And the human body is so amazing because we can create a lot of this ourselves. Cholesterol is made from scratch in our body. It's made from scratch because cholesterol is needed to help with the cell membrane. So that means the outer lining of the cell wall. It helps that cell be a little more fluid. That's what cholesterol does. Cholesterol is also a precursor, or it is used to make some of our steroids. So testosterone, estrogen. It also is used for some of our fat soluble vitamins. So vitamins that can dissolve better in fat. So that's our vitamin D, vitamin K. Mm-hmm. So that's some of the role of the cholesterol, and with glucose as well too. So glucose, very, very necessary for our body. Our cells, with the signal from insulin, our cells will take in the glucose and it will use it for energy for our body. Right. So all of these things do work together to maintain what we call homeostasis. So that's how our body functions. We have 11 different systems in our body that all work together to keep our body balanced. That's what homeostasis means, to keep our body balanced. So the issue comes in when we talk about high cholesterol. So there are different types of cholesterol. So you may see when you get labs done, you may see total cholesterol number. It may be, who knows, 190, 200, maybe over 200. And you may see LDL cholesterol, and then you may see HDL cholesterol, and then you may see triglycerides, other. So the main two cholesterols are LDL. And when we say LDL, that stands for lipoprotein. And that is the protein that we need for cholesterol to travel throughout our blood, because cholesterol is a fatty object, and our blood is mainly made up of water, plasma, right? So we need something to help smoothly transport that cholesterol throughout our body. So what the LDL does, it transports the cholesterol to make from our liver, from our diet, but it transports it to other parts of our body. Where the HDL, and they sometimes call, they not sometimes, they call the LDL bad cholesterol, because that's what it does. It takes the cholesterol and it transports it all throughout our body, where it can stick in our blood vessels. It can go to our adrenals to help make some of our hormones. It can go different places in our body, right? But it can also get stuck in our blood vessels. And then we talk about HDL, high density lipoprotein. This is just talking about the different density of them. However, they have different functions. The high density lipoprotein cholesterol carries cholesterol from different sites of our body back to the liver for it to be broken down. So our body does this normally. Our body creates cholesterol normally because we need it. It's essential. However, the issue comes in when we're eating a bunch of fatty foods. We're eating greasy foods. So we're giving our body a bunch of extra cholesterol that may not be needed. And although there is what we call a feedback mechanism, so meaning essentially when we do have more dietary cholesterol, it inhibits our body from making extra cholesterol. But when you're taking in too much, it's especially certain fats that you're taking in. We're talking about saturated and unsaturated fats, but these things can stick to our blood vessels. And this is what leads to what we call atherosclerosis, or narrowing of the blood vessels. And that is what leads to heart disease, stroke, peripheral artery disease. So if you have disease of the arteries in your legs, all of this is caused by atherosclerosis, which is narrowing of our blood vessels, because we have the cholesterol that is sticking to our arteries, damaging our arteries. Then we get calcifications, blood clots. So it's a long process that happens when we have these high levels of cholesterol sticking to our arteries. But essentially, that is the function of cholesterol.
Man. So y'all see my name at the bottom. I go by Tariq Cardiac. So anything heart related, I'm like wide-eyed. You know, you saw how attentively I was listening to our sister. She was breaking that down, because my background is literally the same as hers. When I tell you, I've seen so many blocked arteries, so many terrible angiograms. You know, I've seen the plaque buildup be extracted from the artery and look like a little piece of ziti on a piece of a microscope, right?
Man.
So these ailments that we deal with are really tapping into, or really taking advantage of, our natural systems in our body. And the enemy is brilliant for that, really. You know, why introduce something else when he can just manipulate and destroy what you already have? You know, so this has been an incredible conversation. We're at the 48-minute mark. Let's get to some of the comments. Let me see. Which one can I pull from? All right. So this is from G. Assalamu alaikum. Are there any particular heart conditions that we should be aware of post-COVID?
That's a great question. So I cannot personally say that I have seen many post-cardiac. At most, maybe just like what they call myocarditis. So that is inflammation of the myocardium, the heart muscle. But I cannot say that for sure. Definitely, this is post-COVID. So I would have to get back to you on that question. I don't have a lot of data, or I have not seen personally a lot of cardiac post-COVID conditions, but I'm sure there could be some. There's so many post-COVID syndrome going out right now, so there could be some. I won't say there aren't, but to my knowledge, I'm not exactly sure.
Okay, awesome. And we have something from Brother Salah. This goes back to our conversation we had on Cuba. This conversation is amazing. This sister is very knowledgeable. All praises due to Allah. I understand that our sister studied in Cuba. Is this the same program that the Honorable Minister Louis Farrakhan offered some years ago? Is that program offered now, or will it be offered in the future? Offered in the near future?
Yeah, so this is the program that the Honorable Minister Louis Farrakhan offered a few years ago. It is still being offered. If I'm not mistaken, they do have an age limit on it, 18 to 25 years old. And there have been talks about them possibly stopping it, like stopping, I'm not going to say altogether, but maybe just the US portion of it. I'm not exactly sure, but as of right now, they are still accepting applications. So if anyone is interested, I can give you the information. I believe their website is ifcopastorsforpeace.org. That is where they have the application and information about the prerequisites that are needed to apply to the medical school in Cuba.
Absolutely, absolutely. And that relationship that the Honorable Minister Louis Farrakhan built with Fidel Castro precedes the school. Like, they were very close when it came to the upliftment of Black people and and any group of people who have been oppressed around the world. So that relationship that they formed to have people or students from the Nation of Islam to go over there and study under those amazing educators that they have and the healthcare system that they have to back it up, is incredible, right? As a matter of fact, it was you and two other students, the granddaughters of the Honorable Minister Louis Farrakhan, actually were on the program as well, and they talked about their journeys. How have the three of you and anyone else from the nation or anybody that you came up with in this program, how have you been able to look at what each other are doing and be inspired from that?
Oh, that's a good question. So all of us so we're doing different things right now. I think either way, we're inspired by each other either way, because we all made it through medical school in Cuba. And that was a journey that we were able to share together. Dr. Rakaya, Dr. Mariam, and Dr. Shaquel. He is from those two are the minister's granddaughter. Dr. Shaquel is a brother out of New York. He's currently doing his residency. I can't remember what hospital he's at. I think he may be doing family medicine. Do not quote me on that. And then Dr. Isan, she is from DC. She is also she's also a graduate of the program. So,
Dr. Isan, forgive me, I forgot to mention her, but she's also been on the
yes. Yes. And she, everybody's doing amazing things. And then even doing amazing things and coming back and also starting their lives, married, having children, and also still trying to, be involved in their careers. So I think what everybody is doing is very inspiring. I think we all, we don't get to talk as much as we would like. Probably everybody's busy with life, but like I said, there's always just a mutual respect with everybody. Just because we came through the program together, we were blessed to be the few of the nation who were able to benefit from the medical training in Cuba. So, we're very blessed. And like I said, everybody is, trying, working their best and trying to develop their careers and also starting families. And yeah.
All praise due to Allah. Yes, man, that's what it's all about. Let's see, what else do we have here? So we're approaching family. We like to keep the show at about an hour so that you can digest it. It's digestible. And we want to make sure that we get everybody recognized. This is brother Trevor Westwood from London.
Okay. Like, you know what? It says Brother Tendai. It does say Trevor, but it says something Brother Tendai tuned in from London. So he actually, the believers, I have to say this, the believers in London were absolutely amazing. Brother Tendai, Brother Jeffrey, they picked me and my family up from the airport when we got into London. They took us to the mosque. They took us back to the airport, and those drives were not short. Those were like some hour and a half drives each way. So I just wanted to just say that we are very grateful, and I'm happy that he's on here, because I'm like, oh my God. So yeah.
Praise be to Allah. Shout out to the believers in London.
Yes.
All right. So that we have, let me see, what else do we have here? We have MA Travels tuning in from Indonesia, which is incredible for us. We've had viewers from all over the world, but from Indonesia, that's a blessing right there.
Amazing.
All right, and now we have. All right, so we have a couple questions here. Let's see. Let's do this one. So we just got finished talking about cholesterol, good, bad cholesterol. Is there a way for herbs to cleanse or help remove plaque from arteries? How does one reduce the bad cholesterol?
Yeah, so there are a few herbs that I have heard people taking that I can't. So the thing with sometimes with some of the herbs, there's not a lot of, I would say, much data on them. But for example, you'll see people taking things like red rice yeast. That is something I see a lot of people take. But I would say one of the ways that you can help reduce your bad cholesterol is all in the things that I already mentioned. Reducing if you're overweight, obese, reducing your weight is something that will decrease your LDL, your bad cholesterol. Increasing vegetables in your diet, decreasing fatty foods, trans fats. Those are some of our unsaturated fats that have been through medical process that stick to our arteries. So decreasing our fast foods, fried foods. Also our I mentioned our vegetables, increase our vegetables in our diet, and then increasing more of the good fats as well too. So things like, I always love to say avocado. That's something really good that can help with the good cholesterol, because the idea is that you want to try and also increase the HDL as well too. So we decrease our LDL, but you also want to increase that HDL, because the HDL is also that transporter that takes the cholesterol back to our liver to be metabolized or digested. So that would be some ways that I would say to try reduce the bad cholesterol. But start with the weight loss, start with our diet, start with our blood pressure. Blood pressure also damages our arteries, which makes them a better place for cholesterol to sit on. So try and control our blood pressure as well. And what does that also have to do with our stress levels? All of these things are interconnected. All of these can be used. There's no way that you can implement these healthy lifestyle changes and not see some changes in your health outcomes. And sometimes we may not even be aware. We think we may have a good diet, but sometimes if you actually maybe use a food diary, or you actually write down some of what you ate yesterday, or talk about it out loud, and we may not be doing all the things that we think we're doing. I particularly had a patient in clinic, and I was seeing him for diabetes and hypertension. He had both. And I said, okay, well, tell me, how's your diet? My diet's okay. I said, okay, tell me more. Like, what do you eat? How many times a day do you eat? He said 3. I said, okay, what do you eat for breakfast? And he starts telling me, oh, I eat Frosted Flakes. Oh, I eat 2 bagels. Oh, I eat. Okay, so bunch of carbs, not helping our blood sugars. That's fine. No problem. What do you eat for lunch? A hot dog, a rib, some mac and cheese, or I may just buy a hamburger. So sometimes, and then, and I do the same thing for dinner. Oh, and then I also have my soda for my, I drink soda. I drink very sugary juices. So sometimes too, if you feel like you think you're doing all the right things, and maybe you feel like you may be at a crossroads, maybe writing down some things, doing a food diary to actually reassess it. And actually, if you are seeing a primary care doctor, you can always ask to be referred to a nutritionist. In our clinic, especially for our patients with diabetes, we refer them immediately to a nutritionist. So I think that is something you can always ask if they don't offer it, because that may be helpful, because sometimes they can also go with you. How do you look at nutrition labels? How do I identify what is actually in here? How do I identify how much carbs is in it? How do I identify this has saturated fats, unsaturated fats? I think these are good conversations to have. And that's why I think it's very important to have a primary care doctor and feel comfortable asking, like, hey, I want to speak to a nutritionist about my diet, and see where he's in areas that I can improve. So that's what I would say. I do think there are many herbs, honestly, on the market right now. I see people coming using many different things. The only one that I know that I see more often than not is the red rice yeast. But like I said, once again, there's not particular data on that for me to absolutely say that this is something that is used. But what we can absolutely know is that diet definitely helps. In addition to exercise, weight loss, not smoking cigarettes, reducing alcohol intake if that's something that you do. So all of these things are helpful in decreasing the bad cholesterol, also focusing on trying to increase your good cholesterol too.
Yes, ma'am. Absolutely. So we're at that hour mark. I wanted to ask you one final question. We talked about, and people, for those who are watching, please put a black fist in the comment section if this has been an incredible episode for you. If you have learned something, if you have gained some type of knowledge that you can use to apply it to your life, please drop a couple black fists in the comment section. So my last question, right? We talked about you being in London, right? I saw the audience that you was presenting to, so I'm gonna have to ask you. So how have you been able to, as a black woman, we're talking about black women healing the heart, right? As a black woman in your residency, about to become one of the world's greatest cardiologists, and I'm gonna speak that into existence, right? So how have you been able to bust up any common misconceptions about black women in medicine that you may have experienced, that you may have heard about? What are some of the things that you've been able to kind of, break up as you're journeying throughout your residency?
In the humblest way, I show up and deliver. And I think sometimes when you see, I'm mainly the only black woman in my there's one other, but dark-skinned black woman amongst a large group of internal medicine. They don't see many of us. And a lot of times, and it's crazy, it's an hour already, but a lot of times we do suffer from what we call imposter syndrome, or feeling like you're out of place because you're the only one there. Going to cardiology conferences and you're like the only one that looks like you. But what happens is what you do is you show up and deliver. And that's how you bust up the misconceptions. That's how you bust up the ideas that people may have about you, that you're not supposed to be there. You're supposed to be there. You earned to be there. And so I work diligently, I work humbly, and I show up and deliver. And I think that's the best way to break up any misconceptions, is by doing the work, caring for my patients, in being that physician that they wanted to see. Like I said, it brings me so much joy when I walk into rooms and people are relieved that they see somebody that looks like them. So by showing up and delivering, and for anybody who's out there doing it as a minority in their field, show up and deliver. That is the best way. It's more than words could ever show.
Absolutely. That relief is real. The relief is real. Letting that guard down and being able to see somebody that looks like you, and now you can not maybe sit back and relax, but now you feel a little bit at ease that this particular person has your healthcare in their hands, and that's showing up and deliver, right? A lot of times that imposter syndrome comes from not delivering, right? Or when we get the opportunity, we don't, follow through with it. So,
And I'll just add this. Sorry to cut you off, but not even just not delivering, but also I think you're in an environment sometimes where people like to make you feel like they're better than you. People like to make you feel like they're smarter than you. People like to make you feel like you're not supposed to be there. But you have to be reminded that you worked to be there. They're there, you're there like they're there. So I think what I deal with is that people that want to try and make you feel like they're better than. So it's not even about you're doing what you're supposed to do, but just be confident when you do it. Know that you're there for a reason. Know that you have a reason to keep going. These are the ways that you get rid of that imposter syndrome, and just not letting anybody put fear in you. You believe in the Most High, and that's how you move.
Absolutely. Yes, ma'am. Well, first and foremost, before we conclude, thank you so much for joining us on the Stand Files. This is your fourth time on the program, I think.
That sounds about right.
Yeah, absolutely. We like I was saying in the beginning of the program, you've been with us since the time you left Cuba to now, and this has been an amazing last 3 years for you now. And I'm proud. I'm sure the people in the comment section are proud. Those who are watching, the entire nation, Black people, are proud of what you're doing and what you're going to become. Any final remarks for the people who are watching? Anything that you like to say? Anything that you like to say? A young Black woman coming up in high school who would like to be a physician, who would like to go into cardiology specifically. Anything that you like to say to them?
Absolutely. So I think overall, what I would say is number one, I think me, like I said, focusing on prevention, making that my main reason that I keep going, I would encourage everybody to take authority and control over their health. Get tapped in with the primary care doctor and feel empowered to ask questions, feel empowered to take some control over your health and have those necessary discussions. I think the next thing I would say is for the young people, young Black woman, who wants to do it, who wants to be a doctor, we need you. The field needs you. There are not enough of us. And I think if you want to do it, don't ever feel like you can't. There may not be many of us, but there are some of us. And I think most of us would be open to talking to you, to guiding you and helping you along that journey. You can put my Instagram up again. I'm open if anybody wants to reach out to me, ask me any questions. But I thank you so much for inviting me on the show again. It was absolutely a pleasure. And thank you.
Praise be to Allah. Well, family, this has been another edition of the STEM Files, where we serve as the voice of STEM talent and Black culture. And we highlight the best and brightest in science, technology, engineering, and mathematics. Also, family, if you would like to learn or stay in touch with us and be able to, follow us and stay engaged with us on our social media platforms, hosted by @TariqCardiac, @Jabrian_engineer, and @The Chi Mechanic. Follow us on all platforms: YouTube, Facebook, Instagram, Twitter, as well as TikTok @The STEM Files, family. Once again, this has been your voice of science, technology, engineering, and mathematics in the Black brown community. Tariq Cardiac, usually joined by Jabrian Engineer and the Chi Mechanic, with our amazing guest, Sister Dr. Naa'irah Muhammad. Thank you all for tuning in. Until next time, peace.
You believe in these false prophets, I say I bet he lying. No football, New York City Giants. Girl dad, rest in peace to Kobe Bryant. When we teaching our babies, we teach them heavy science. Heavy science. Heavy science. When we teaching our women, we teach them heavy science. Heavy science. Heavy science. When we teach men, we teach them.
I am Dr. Naa'irah Muhammad. I am an internal medicine resident physician at Henry Ford Hospital in Detroit, Michigan. I have a passion for cardiology and heart health, along with preventive medicine. I am happy to announce that I will be your next guest on the STEM Files on September 19th for the season premiere. Look forward to talking to you all soon.